Knock knock. I'm gonna wash my hands. Hello, Christy. How are you today?
Hey, I'm really good, thank you. How are you?
That's great, Christy. I'm Camilo Gilaver. I'm the treating physiotherapy today. How are you feeling?
Not too bad.
Not too bad. Great. Do you mind if I have a seat in this chair here, please?
Yeah, go for it.
Here's your phone. Sorry. Christy, so I can know that I'm with the right patient. Will you please tell me your full name, date of birth, and age, please?
Yes, I'm Christy Jones. I'm 31 years old. My date of birth is the 13th of July of 1992.
Okay, thanks Christy for sharing that with me. As you can see here, this is an exam situation. You will see my assessor X and Y. They will be assessing me. Is that alright for you?
Yeah, go for
Cool.
it.
Christy, have you been in physiotherapy before?
No, I cannot afford it.
No, you cannot afford it. That's great. That's fine. Sorry. So Christy, just to let you know a little bit how this session is gonna look like. The first part is gonna be me asking you a few questions just to get to know you better. Second part is gonna be hands-on assessment, and the third part is gonna be exercises and planning some goals and doing some exercises. How does it sound to you?
Yeah, right.
All right, you okay with it?
Yeah.
That's great, Christy. I don't have much information from your referral. I know that you came here because you had low back pain since probably a week ago. Is that correct?
That's alright. Yeah.
All right, Christy. So 1 week of low back pain. Would you mind telling me where is this pain located?
So it's like my lower back on the left side, and like it's going like below my leg.
Okay, to the back of your leg, to the
Yeah,
front.
the back of my leg, and like it. Yeah, it's been very bad.
And did it happen all of a sudden? Was something that produced
Well,
this
like
pain?
8 days ago, I was at home, like I was lifting my daughter. She's at 2 years old, and I just suddenly feel like everything, like a numbness or like a pin, like a just. It was so weird, like just I couldn't move anymore.
Got it, got it. So it happened 8 days ago. You were lifting something. You were lifting your daughter. So sorry, and all of a sudden you felt something that was not right in the back of your,
Yeah,
in your back, low back.
that's
All
correct.
right, and that pain, you told me that was going running through the back of your glutes, going back.
Yeah, all this week it's been like I can feel it like even in my leg, like I cannot like put the weight on that leg because it started to feel very painful.
Very painful.
And yeah.
All right. Other than that, have you found something apart from pain and like I don't? You told me something about numbness. Have you feel tingling?
No, it's like not much like tingling or numbness. It was like more like a sharp pain,
Sharp pain.
like yeah, but very dull, and ache.
Very achy. Okay, that's all good. Thanks for sharing that, Christy. In regards to this pain, you already told me this is a sort of dual achy pain that runs and it's also shooting like behind your leg.
Yeah, exactly.
No electrical feeling, like any.
Yeah, sometimes yes.
Sometimes you
Yes.
feel like electricity running down through your leg.
Mm.
And what is the further it goes, like behind your foot as well, or just
Sometimes yes, even my foot.
even your foot?
Yeah,
Right.
it's depending. Like at the moment, it's not too bad. It's just localized in there, but yeah, in certain movements, I go just have so much pain.
Sure thing. Christy, I would like to ask you: have you noticed any weakness in that side of the body, like that leg?
Yes, I mean, yeah, I suppose yes. Not like I couldn't move, but I'm trying to don't move
You
much.
try to stay still,
So
probably.
I feel like it started getting like very like not used.
Okay, that's all right, Christy. What sort of movements aggravates your pain?
So when I try to bend forward and when I try to like lift something, and well, the doctors anyway say that I shouldn't like lift anything heavier than 2 kilos, but with a daughter it's very
It's
hard,
hard, I know.
like
I
it's
know.
impossible. I need to do it, and it's very frustrating because like I'm just by myself, so it's like yeah, it's very hard.
It's very hard. You say you are by yourself, meaning that your partner or your are you married?
No, no, I'm not. I'm a single mom.
You're a single mom,
Yeah.
and are you finding yourself like struggling on that probably?
Yeah, it's very hard. Yeah, yeah. Like
Have
last.
you ever talked with somebody about it?
Well, yeah, I have few friends and like, yeah, they're trying to help. But like, everyone have their own life,
Mm.
and yeah,
Yeah, I know that must be really hard.
it
Anyway,
is.
Christy, I will like just to share with you my thoughts about it because there is a lot of resources available, like I don't know, psychologists or or social workers that could give you a hand on that. Maybe put yourself in contact with any sort of uh, assistance on that matter.
Yeah, the
That
doctor
probably will.
also mentioned that, but like I suddenly like I'm not working at the moment, so I'm unemployed, so I definitely cannot afford it. I'm struggling with
But yeah,
like
probably
some.
the social worker can give you a hand on that end. You can
Right.
share your situation, your all your thoughts on that, and maybe the social worker can come back with some sort of assistance for you, so you can sort this thing out a bit easily. How does
Yeah.
it sound to you?
Yeah, I don't know. Like, I mean, they just give me like some vouchers for the doctor's appointment,
Mm.
but yeah, I'm not sure how that works.
Mm. All right. Keep that in mind, Christy. If anything, you feel like this will be a good option, just probably I will be more than happy to at the end of this session just share with you a few sheets of information so you can have a little bit of information so on what can they help you with, you know.
Right.
All right, but keep that in mind, Christy. It's fine. It's fine. It's just something that I wanted to, probably will be good too for you, and I highly recommend you to give it a shot. But keep that in mind
Okay.
at this stage. All right, Christy, you told me that bending forward, lifting things were some sort of movement that aggravates your pain. Is anything else that aggravates your pain, like bending sideways?
Yeah, I don't even try to do that because, like,
If you
yeah.
do like so or like that, is any
Yeah,
move?
now when I go like to the left, it's so bad.
It's
Yeah.
so bad. When you go to the right, it's a little bit better.
Yeah, I mean, still like, I feel very rigid. I'm like,
Very
I'm
stiff.
a robot. Yeah.
Yeah, good. And is any movement that alleviates your pain, or not moving, like probably even rest?
Yeah, sometimes when I'm like laying down, like not moving much, but like anyways, I need to like move. Like my kids not.
No, at 2 years old, I am a father myself, so I know how a 2 year old is. So
Yeah.
you have to
Yeah.
keep
So
moving
it's,
the whole day. I know has to be really hard. But when you are laying down after the day or even early in the morning, is it better?
yeah, a little bit. If I'm like too long in the same position, it's still like pain. So it's like,
No. So you feel like you need to. Does the movement helps you a little bit?
yeah, help me. But like when I need to like sit again, I'm struggling too much. Like to the transitions to like stand up. Like yeah.
Yeah, no, I know. Just bending, just having a seat and getting upright from the seat is something really painful. But you told me that movement sort of alleviate a little bit your pain
Yeah,
and
sometimes like,
resting.
yeah, resting. If I'm resting, it's alleviate, but not too long in the same position.
Mm.
And then when I start to move, it kind of like it depending. If I'm keep straight, it's not too bad. But if I do any like a rotation or anything like to look behind, I need to literally like walk as a robot to like.
Yeah, I know how it feels. So, what about if you try to bend your trunk to the back, like extension? Does it
Yeah.
get
Also,
better?
no, it's also like very bad.
It's very bad. All right, I'm gonna go further when I do my hands-on assessment, but just want to make like a full picture of how this is affecting you.
Right.
If you could say, Christy, when you are feeling okay and the pain is not, not bad, and you are resting in a comfortable position, how is your pain on that?
like right now I'm in a comfortable position and maybe it's like 5 out of 10.
Okay. Yeah, you know how to rate it because the way that we can rate it is from 0, which is not pain at all, and 10 is the worst pain that you could ever imagine. So would you rate it when you are not moving like a 5?
Yeah, like half, yeah.
And what happened when it get worse when you do those sort of movements?
Oh no, it's too bad. It's like 8. Yeah, sometimes, yeah, it's just so hard.
It's so hard. Yeah. Okay, Christy. I can make the full picture of that. Are you using any pain meds that the GP
Yeah,
gave you?
I'm using Panadol,
Mm-hmm.
and he said like anytime that I have any like pain, I can use it like with no issues. But
Okay.
I'm taking like 6 or 8 a day.
6 or 8 a day. Is
Yeah.
that something that your GP advised to do?
Yes. Mm.
Like,
Anytime that I feel pain,
mm.
so I'm like, it's the only way to like keep it
And do you
moving.
know how much Panadol? You say 6, but 6 of 500 milligrams?
I'm not sure.
You're not too sure. All right. Look, Christy, I am more than happy to have a sort of chat with your GP if you are okay with that, because I need to find out what is the right schedule for your pain meds.
Yeah.
And also, I would like to know if you feel like these pain meds are working on you. Otherwise, would be a good idea if you and your GP can review that.
Okay.
Sounds like a plan to you?
Yeah. Well, like I mean, I saw him like a few days ago,
Hmm.
and he reckoned like I should go with the physio
All right.
to try to get better.
Mm-hmm.
But yeah.
I know. The thing that I want you to discuss with your GP, Christy, is first thing your schedule for pain meds, and also if you feel like your meds are working. Otherwise, maybe you can suggest him to go with another uh, pain medication, so we can work together with the physio and pain meds to reduce a little bit your pain. How
Right.
does it sound to you?
Yeah.
And also you don't go over the maximum dose for Panadol, because Panadol has um, you cannot take as much as you can. You just can take like 1 milligram each 6 hours or so. So that's something that your GP has to review with you. And yeah, 100% come with a right schedule and make things clear for you.
Right.
All right.
Mhm.
So Christy, I already know about your low back pain and how this is affecting you in your daily life, but I would like to know if there is any other medical conditions that I should be aware of.
Um. Yeah. Like I visit the rheumatologist, and he said like I got fibromyalgia.
Sounds like something that I was thinking. You know what fibromyalgia is?
Not too sure.
Not too sure. Because probably I will also want to make a note for your GP, and
Mhm.
he will be able to explain you in more deep what fibromyalgia is.
Mhm.
But overall, probably it will be something like related to uh, the the threshold for pain is a little bit low, so you will be feeling pain in your shoulders, back, probably your glute sides. You will feel a little bit of tired or fatigue during the day. Is that something that is happening to you?
Yeah. Yes. Yeah.
Okay, so at the same time, the GP could give you some hints on how to address fibromyalgia, if there is any referral proper to do, and I'm also aware that fibromyalgia is good for the patients to put them in contact with a psychologist, so we can work as a team. You know what I mean? I know this is something that you already thought about it and doesn't sound like a plan at this stage, but my recommendation is I mean, I'm highly recommending you to think about it at this stage. Think on the option of going and you know um, have a conversation with the GP. So maybe you can go back to your psychologist, or so we can treat you not only as a back but as a whole person.
Right.
You know what I mean?
Yeah.
All right, cool. So, Christy, are you taking any meds for fibromyalgia?
Just the yeah the painkiller like
Painkillers.
same
All
thing.
right.
Yeah.
And do you have any allergy, any other medical conditions that?
No, not that
Okay.
I'm aware of.
In terms of your home, Christy, do you live in a single-story house, a double-story house?
Single story house.
Okay. And do you have steps to get
Mm,
in and out of your house, or
no, there's
is it
no
flat?
steps. Yeah, flat.
Flat, good. And what about the in-house setting? Is it appropriate for you to walk in and be you independent there, or do you
Yeah.
find yourself struggling with getting into the shower, going to the toilet, and stuff like that?
Well, when I have to go to the toilet like every time that I need to stand up, it's a bit too bad, but I think it is what it is.
Mm, yeah, sure, for sure, for sure. I can imagine how hard is it. Again, Christy, there is a whole team that is dedicated to give the best support for the patients. So there is another health professional called the occupational therapist that if you find yourself like you are struggling to get in and out of your bed or in and out of your shower or toilet, maybe in the next session you can tell me about it and maybe we can have a conversation with the occupational therapist so they can assess your home properly and see if there is anything that we can improve to make things easier for you.
Right.
Okay? So, Christy, just before we can go ahead, I would like to rule out a few red flags, okay? Things that will need a little bit of further assessment. Have you ever experienced any sudden loss of sensation in one side of your body?
Um, no,
No? What about any sudden weakness in any side of your body?
no,
Any problem swallowing or coughing or speaking, articulating your words?
not really.
Any problem with your sight or your taste?
No,
Cough?
no,
What about night sweats?
no sweat, but like when at night time, like it's very hard for me to like
Sleep?
sleep.
Catch a
Yeah,
sleep.
the
Yeah.
pain is severe, so it's affecting me like the
All right.
sleep.
I'm keeping notes of all those things that you are telling me so I can write a proper note for your GP so we can address like all this sort of stuff, all right?
Right.
All right. Have you experienced like chills or fever
No,
in the last month? Any cough? Did you tell me cough? Not,
no,
not
no
at all.
cough.
And what about any unremitting pain apart from your low back pain, and your leg
Well,
pain?
yeah, I don't know, like with this like fibromyalgia, I think it's
Fibromyalgia,
kind
yeah.
of I know sometimes it's there and like yeah.
Okay. And what about any problems? If you don't mind me asking, any problem with your bowel or bladder?
Yeah, yes, I've been having like a irritable bowel
So going to the
sy-
toilet more often,
syndrome. Yeah,
like probably pain in your
yeah, I've
abdominal
been
zone and your
diagnosed with
back.
the irritable bowel syndrome like yeah a few months ago. So like this is when I started with the rheumatologist and like yeah.
Yeah. Okay. Okay, but you are keeping in touch with your rheumatologist anytime soon? Like, are you gonna?
Yeah, I'm supposed to see him like in a few weeks. Yeah.
Cool. That's great, Christy. Because again, this is something that we need to address not only as a low back pain, but as a person that is having issues in terms of his fibromyalgia, his pain on the back, that lives with 2 years old and needs things to be done, and there is some issues with your work. So I will write down all this sort of stuff that we have discussed today to your GP,
Right.
so he can direct us, all of us, to make the proper adjustments and assessment to help you better.
Right.
Okay,
Yeah.
cool, Christy. What are your thoughts about the physiotherapy sessions? What do you like to achieve from the physio sessions?
Well, like I'm not too sure what I go. Like I just read in like um, internet like my symptoms, and I kind of like I thought like I might have like a disc protrusion, something like that. and I would like to know if it's actually that is the maybe it's the cause, or like what is going on with me, because I'm
Okay.
not too sure. Like I just read and I kind of like everything like makes sense with my symptoms, but I'm not sure.
Well, the things that you have told me so far match with what this protrusion looks like, but
Mm-hmm.
also there is some other pathologies that
What is
produces.
a disc protrusion? I mean,
Well, your spine has vertebral bodies,
right,
and in between them there is a sort of a cushion, like a springy thing that looks like a donut,
right,
all right, a round donut. That on the center of this donut there is some sort of slimy thing, very liquid thing, and when we get some sort of repetitive compression or a maximal compression on these vertebral bodies, makes the center of the donuts to migrate away from the center and goes, to the outer layers of this disc. Are
right.
you following me?
Yeah,
Cool. So what happening is that the liquid center of the donut migrates away from the center itself and goes to the outer layers. And because it goes to the outer layers of this donut, starts compressing the spine, or it could compress as well the nerve roots that comes out of the spine. Because you know that the spine has, in between each vertebral body there is some nerve roots that goes out and runs to your limbs, to your chest, to your um, lower limbs as well, and
right.
controls your muscles, controls pretty much everything.
Yeah, that sounds very bad. Like that means like I will have this forever.
This protrusion is something that I am keeping in mind, but there is other conditions that I need to rule out before we can make, like a probable cause of this pain. But in terms of the disc protrusion, it's something that people can live with, and after a time, it can resolve itself if we manage it well.
Right.
So kind of it goes back, you know.
Let's go back. How
How
so?
does it? What does it mean? It means that the protrusion, or the fact that the liquid itself went to the outer layers, we can make it to go again to the inner part of this
Kind of
donut.
like a reabsorb.
Probably reabsorb, or probably make it better, feels better, or reduce the symptoms.
Right.
You know what I mean?
So it means like I can work. Maybe
Yeah,
like
probably you will be able to work. Probably you
okay.
will be able to do your stuff, but this will be close linked to how we manage this and we respect the healing time of your body, which is something that I'm a bit concerned, because you have a 2 years old and you are pretty much by yourself with her, and at the same time you will need to have a sort of a rest and change a little bit of your behavior in terms of how do you pick her up, how do you do your cleaning, how do you cook, how do you do your daily life with your 2 years old. So probably I'm just thinking out loud. Probably will be a good idea to have an extra pair of hands in for 1 week or so.
Yeah, but like my mom passed away last year, and like she
Mhm.
was my only support.
Uh,
Even
that's what
like
I was talking to you about, the social worker. Maybe the social worker can come up with a sort of solution in terms of how can we as a team help you to respect those healing times and make things a little bit easier for you to deal with your daily life. You're 2 years old, and at the same time respecting your healing times of your back.
right.
All right, so keep that in mind, and you will tell me at the end of the session if that's something that you will consider. All right.
Okay.
So that's your probably your short-term goal, but is something else that you want to achieve from today's session?
I just want to like have a normal life, like be able to like. It's so hard to like
Cope with everything.
yeah, like being a mother. Like I don't have much support, and yeah, 2 years old is just like she's
They're
doing
everywhere.
everything.
I know.
And
All right, Christy. That sounds fair to me. That's probably a long-term goal. But what about today? If you think of today's session, is something else that you want to achieve for today's session, like just now?
yeah, like my pain is like too bad. Like I don't know. Like I don't know what I should do about it.
Okay, fair enough.
So
Thanks, Christy. Thanks for sharing. So, 100% we will work on your pain levels. Probably will be this something that you consider as a short-term goal to reduce a little bit your pain and go back to your house today with a little bit of less pain.
right.
Sounds like something that you want to achieve for today.
Yeah. Like
Okay.
but I'm not sure if should I move because like when like because the doctor also explained me like something pretty similar like you and
Mm-hmm.
like I'm very scared to move now. Like
Okay, that's
so
pretty fair, Christy. Before we can go ahead with the explanation and all this education stuff, I would like to make clear and rule out all the other conditions and know that we are working on a disc protrusion rather than something else. Okay? So
right.
I don't want to scare you beforehand.
Okay.
Okay?
Yeah.
Is there anything else that you want to share with me in regards to your health that you think it's important?
No, that should be alright.
Okay, cool, Christy. You told me that your pain is located on your low back
Yeah, like
here
most yeah.
and runs down to your leg. It's a shooting pain. It's goes radiating, as I said, shooting, and it's 5/10 when you are resting, and 8 or even 9 out of 10 when you do those movements.
Yeah,
Is that
correct.
correct?
Yeah.
All right, bending forward is worse, make things worse, even twisting.
Yeah.
You feel like you cannot do that because you are moving like a sort of a robot.
Yeah, I feel like I'm
Yeah?
putting on my body in like the right side because like if I put weight on my left, it feels so bad.
So bad. That's okay, Christy. Before you stand up, how did you came to the clinic today? Did you walk by yourself?
Yes.
Are you walking with something like any assistive device,
No.
a cane or something? Okay. So
Just
you can walk by yourself.
yeah, but very slow.
Very slow. All right, can you lift up your knee towards the ceiling, please, for me? Up, 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 up. Keep it there. Don't let me push you down.
Yeah.
Don't let me push you down. Great. Extend your knee, please, for me. Up, 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 up. Yeah, and don't let me push you down. Okay. What about the feet? Can you wiggle your feet up and down? Up and leave it there. Don't let me push you down. Don't let me push you down. Great. And now push my hand. Great. Now, I want to do the same with your left leg, but keep in mind the pain, okay,
Right.
Christy? So, what does it mean if something is hurting, just stop
Right.
and let me know, all right?
Right.
All right, take your knee up toward the ceiling, please. That's the further you can go. Great. Don't let me push you down. Don't let me push you down.
Yeah, yeah, yeah.
Pain. 8 out of 10, how much is it?
Mm, maybe like 7.
Maybe like 7. Okay. I don't know if we can see properly here, but yeah. Extend your knee, please. How is the pain here?
Yeah, it's bad.
Worse than
Yes.
before? How much worse?
Like maybe 8, 9.
Okay, it's very bad. And does this pain goes running
Yes.
through? Okay. And what about now that I'm doing
That's
this? That's worse?
yes.
Okay, not gonna do that. Extend your knee now for me, please. Extend your knee. All right, good job. Now, press my hand. Press my hand here. Okay, good. Now, lift your toe up toward the ceiling. Up, 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 up. And then let me push you down. And now, down for me. Good job. Overall, just a little bit of less strength on this side I mean, this left lower limb. A
Mhm.
little bit of less strength, which is something I was expecting. Okay? Now,
Right.
the second thing that I want to do is to assess if your sensation is the same in both sides. So, can I put my hands on your thighs? Can you close your eyes and let me know if does it feels the same?
Yes.
Does it feel the same?
Yeah.
Does it feel the same?
Yes.
Sorry, I'm just going to. Does it feel the same?
Yes.
Does it feel the same?
Yes.
Does it feel the same?
Yeah.
And what about here in your soles? Does it feel the same?
Yeah.
What about in the back of your leg? Does it feel the same?
Yeah.
Okay, great. You can open your eyes now. There is no issues with the sensation, which is great. We are now safe to stand up. Okay?
Right.
All right. Will you show me how do you stand up from a chair now that you are having this sort of pain?
Oh my god, I feel like a grandma.
You feel like a grandma?
Yeah.
All right. Good. I just want to make things easier for you here. I don't know if we can actually see. All right. Good. Good job. I know this was really painful, but I want to show you how you can stand up from a chair without having so much pain.
Right.
First thing first, you're going to go as far as you can back. Feel the chair behind your knees. Feel the chair. Feel the chair.
Yeah.
Are you feeling the chair?
Yeah.
Now, easily go down and grab to both sides and have a seat there. Did it feel a little bit better? Not really?
No.
Not really? Okay. Was the same. Okay, so now when you are standing up from a chair, I want you to scoop forward from me as far as you can. Scoop forward, meaning your bumps goes, yeah, a little bit forward even. All right. And the first thing that we are going to do is make sure your ankles are a little bit behind your knees, so it's going to be easier for you. And try to don't lean forward because that's a movement that aggravates your pain. All right, so try to stand up like a block, as you say, like a robot. All right, using just your legs. Okay.
Right.
1, 2, 3. Better?
Yeah.
Yeah. Well, that's something that I want you to start doing at home.
Right.
Okay.
Right.
So I can see now that you are standing on your right leg. Are you able to put weight on this side?
Yeah, a little bit.
I know this is going to be painful, so I just want to make sure you can actually handle pain there. There's
Yes.
no knee buckling.
I can do it, but after
It's
like
painful.
after like 5 minutes, I start to feel like very bad. So like I'm trying to don't do it.
Yeah, that's all right. Okay, can you do some marches on the spot for me, please? All right, keep your head straight. All right, you're getting away from the pain, which is something obviously expected. I'm just going to fix a little bit your position there. It is painful, probably.
Yeah, when I straight, make my back straight.
Yeah.
Painful.
All right, try to do some marches on the spot there. Okay, can you walk back and forth for me, please, so I can see you. How's the level of pain now?
That's 6 maybe.
6. You're still having a lot of pain, Christy.
Yeah.
I can see that.
I just hope
Okay.
things go away.
So your walking pattern is well, is alright so far. So I didn't notice any gait impairments. I would like to just one more lap just to double check everything. Okay. I know because you are feeling a lot of pain. Yeah, you're leaning to the right side, which is okay. And now I can see. All right. So, yeah, I already got your pain levels. I already got your gait. So I would like to work on that.
Right.
Okay. So, but because you are having a lot of pain now, I would like to unload a little bit your back.
Right.
Okay, so what does it mean? Are you up for using a cane?
Uh, why? If I have to, yeah.
Yeah, okay. Because I'm gonna bring a cane here with me. Um, because your left side is the side that we want to unload, I want to put a cane on your right hand. This is going to be a cane just for support and make sure you doesn't lean over lean on the right side. Okay? So I know this is going to be painful, but try to walk straight. It's gonna be hard, I know.
Yeah.
Okay? Try to walk with that, please, and see if there is any improvement. All right. Right hand on the cane and right leg at the same time. Good job. Does it feel a little bit better?
Yeah, that feels a bit better.
Okay.
Now I'm actually grandma.
Are you actually grandma? Yeah, that's
Yeah.
great. Come to the plate, please, for me.
Yeah.
And as I told you before, remember, go as far as you can backwards. Try to hold onto the armchair. And yeah, great. Great. Now, Mrs. Christie, I would like to assess your back. Is that okay for you?
Yeah.
Okay. So, can you please lay down, facing downward, please, for me, please? And show me how do you roll on your bed.
Usually go to my right because it feels like
Feels
easier.
better, probably, yeah. I was about to tell you the same. Okay. And then you roll that side and it makes it easier. Is that correct?
Yeah.
I don't want you to fall over, so I'm just gonna put my feet there. Is that okay, Christy, for you if I lift a little bit your shirt?
Yeah.
Okay. Your jumper?
Very warm.
I know, there's a lot of layers of clothes here. Alright. Do you mind, Christy, if I pull your pants just a little bit down?
Yeah, if you can. They're very tight.
Alright. So, can you please, with your hand, point for me where your pain is?
Oh,
Here.
yeah.
Here.
Yeah.
Ah, here. Yeah, that's alright. So you feel your pain here. What about here in this side?
Yeah, a little
I'm
bit
just
too.
checking if the sacroiliac joints are
A little
compromised.
bit
But not. This is not the pain that you are complaining. This is
too.
not the main pain.
I feel it's just so big, so it's not like a one point. It's just.
Alright, so it feels like in all
Yes.
this area.
Yes.
Okay. What about this movement? Does it
No.
produce pain?
No.
What about here? No?
No.
Okay. So probably the sacroiliac joint, which is the joint that is here in your back, is okay. So I'm not concerned of that. Rule that out. What about this movement here?
Not there. There start. Yeah, also there.
All right. And would you say this movement that I'm doing now does it make worse your pain?
Not really.
Not
No.
really.
But I
Alright.
can feel like stiff is all the area.
All right. What about here? Not a problem.
No.
All right. I'm just going to see how your muscles are. They seems to be really stiff, tightened muscles
Yes.
because you have been in pain for a lot. So, are you happy if I do some massage here so we can release a little bit your soft tissue?
Oh, that would be
Is
great.
that okay for you?
That would be great.
Okay. What about the pain here? Is it painful?
Uh, Not too bad. I feel
Not too bad.
tense,
What
but
about here?
there is a bit more. I mean, yes.
Okay. All right.
It doesn't
So
feel very different. Like both feels like pretty similar.
pretty similar. All right. What about the muscles here?
Yes.
Those muscles seems to be really stiff.
Yeah.
All right. So I'm gonna bring my essential oil, baby oil, and do some soft tissue release on your
I,
muscles there. All right, feels very squishy,
yeah,
pretty squishy here.
it's because I'm fat.
You're a mom. You don't have probably much time to do your jogging, your exercises, do you?
No.
Not really.
Should
Yeah.
I?
Um, is anybody that could give you a hand with your daughter?
I don't think so.
Or otherwise you can go for a walk or something with your daughter. That
Yeah,
would be great.
I try to do it.
Every now and then,
Yes, when the weather is good.
when the weather is good. But we are living happily in a very good city, so we have lots of sunny days.
Yeah, it's getting there.
I know. Well, to be honest, going out and having sort of activities outside, having walks on the parks, and spend your days outside rather than inside is going to make you feel a little bit better. It's going to help you with your fibromyalgia as well.
No, I hope
You
no.
knew that?
Not really.
Okay.
Yeah, sometimes I get like just very fatigued, so I'm like, I feel like I'm lazy, but it's so hard sometimes just to
Okay.
deal with everything.
I know. I know, it must be really hard because well, my wife usually take care of the kids while I'm at work, so I can't imagine how it's gonna be, working full time and having a child and living by yourself has to be really, really hard, I think.
Yeah, this is one of the main reasons why I'm not working, but
All right.
I need to work soon because like I'm really struggling with money now.
Okay. How are you feeling now?
Actually, it feels like better.
Feel better?
It's
Okay.
incredible,
There is a lot of muscle spasm here.
right?
Okay, so this is something that we are going to start working on, releasing these muscles, but also give a little bit of movement on your spine because you have not been moving much, and that's something that we don't want. We want just small movement, controlled movement, and not go over on your pain.
Perfect.
All right.
Yeah.
So can you now lay down on your back, please,
Right.
facing up?
Yeah.
All right. Great. How does it feel now?
It feels good. I mean, this position is one of the positions that I can do.
Okay, that's great. I would like just to do just one more test to see if there is any nerve entrapment there. Probably yes. So this is going to be provocative. What does it mean? The movement is going to reproduce your pain and makes it a little bit worse. But let me know when it happens so we don't go over that.
Right.
Okay? So can you lift your leg up for me straight?
Like this?
Yep. Up for me. The further you can go. Because this is not the weak one. You can go over. Great.
Yeah, it feels.
Good muscles.
It feels tense in
Feels
like the back of my
tight
neck.
of the back of your leg, but this is the hamstrings.
Right.
So that's all right. That's all good.
Okay.
No problems here?
Not really.
Okay. We are going to do the same with the left one,
Right.
but remember, let me know when you feel this shooting pain, this some sort of electrical pain, let me know, alright?
Right.
Alright. Lift your leg up for me, please. You're gonna do it yourself. The further you can go,
Yeah, there. I can
there
feel
is it.
Yes.
That's it. Nothing
Yeah.
more.
Yeah.
Now, go back a little bit. Go up now. Feels better?
Yeah, this feels better.
Alright. Now, do the same. Up for me, with your knee extended. Up. Are you feeling the pain?
Yes.
Yeah, leave it there.
Yeah.
Go a little bit back down. And now, did it reproduce your pain?
Yeah.
Okay.
Yeah.
Fair enough. Okay. So, there is two things happening here, Christy. The first thing is that there is some sort of inflammation around your spine, where these nerve roots are coming out from your spine to the rest of your body to your lower leg. Okay?
Right.
Okay, so what are we gonna do is try to give your body, your spine, a little bit of movement, work on this soft tissue release so we can gain a little bit of range of motion and reduce a little bit of your pain, so we can start working on the strengthening of your core muscles, you know the core muscles?
Yeah.
The abdominal muscles, and also all the muscles that keeps straight your spine.
Right.
Okay?
Yeah.
But yeah, that's my plan for the future sessions. So how does it sound to you?
Yeah, good.
Sounds good? Well, I already did some soft tissue release there. I would like to do some nerve glides here. Um, all right, this is going to be a little bit painful.
Yeah, I can feel it.
Yeah, we're going to do just
There's nothing. Yeah.
short nerve glides. We're going to start, what are we gonna do here is trying to pull the nerve, because the nerve runs from your spine toward your feet. We are going to try to pull this rope and release it from where is it pinched on the back.
Right.
Okay? This is something that we're going to do just here in Physio. I don't want you to do at home, okay?
Okay.
Okay. Feels the pain?
Yeah.
Alright, this is gonna be really slow movement. I mean, you can do this at home with your leg up. Keep your leg up and try wiggle your toe up and down. You're going to feel like the pain.
There, I can feel
Yeah,
it.
but try to don't go over 5 or 6.
Right.
Okay?
Can I put it lower?
You can put it lower if you want.
Right.
If that makes it feel better, 10 times is fine for me.
Right.
Okay? The next exercise that we are going to do is, please bend your knee for me. Alright, we're going to start working on glute sets and quad sets. Alright?
Right.
So, glute set is try to tighten your bumps, count to 3 and release. Alright? Tighten your muscles, your glutes, tighten them up, squeeze them up, hold for 3 seconds and then release. This is going to be an isometric exercise. Okay, 10 times.
Like that?
Yeah. Do you feel your bumps are getting squeezed?
Yes.
Okay. That's it. Holding 3 seconds, 10 repetitions. Okay? This is going to be the second exercise at home.
Right.
And we're going to add just one more, so you're going to have 3 exercises to home, to go back home. Okay?
Yeah.
Great. One more time. Pain?
No. Just scared.
Just scared. Okay, so in terms of that, I would like to make things clear, because I know that you feel scared of moving, but movement is going to help us to relieve the pain, but we don't want to over move your joints. What does it mean? Your pain is going to guide you. So is it okay to bend a little bit this side, bend a little bit that side, going forward, going backward, as long as your body allows you, your pain allows you. Don't go over 6 out of 10 on the pain.
Okay.
Okay, so we are going to start probably with really slow movements to one side, and I'm going to show you at the end of this session how are you going to pick things up from the floor. That's going to be the last thing. The next session is going to be more education on that one. Okay? All right. The third exercise is going to be quad sets. So if you can straighten your knee, please, for me. Yeah. And just, try to tighten your quad muscles. Hold to 3 seconds and then release. Take a deep breath, squeeze the quads, hold for 3 seconds, and then release. Do you feel any sort of relief with these exercises? Not really? Okay, fair enough. I mean, I'm happy to don't aggravate your pain. That's it.
Yeah. I'm also surprised that I'm not giving me some pain.
That's cool. That's great. All right, this is the third exercise that you're going to do at home.
Right.
Okay? All right. Bend your knees, please. Please let me know. We are going to do slightly movements toward this side and this side. So let me know when the pain is bad. Okay? How about the pain here?
There. Yeah.
Okay.
That's
Better
good.
now?
Yeah.
Okay, when you are laying down, when your daughter allows you to lay down, which is probably when she is having a nap, maybe you can also lay down next to her and do these movements at home, just to get a little bit of movement on your spine.
Right.
Okay, this will help you. But if you find yourself that going too far away, too far to one side is aggravating your pain, try to make it, a little bit shorter the movement.
Okay.
Make sense?
Yeah.
All right. You can do this 1 minute and then have a rest. All right?
Yeah.
Now, the last thing that I want to show you is, just want to know how is the pain now that we have been doing these exercises?
So it's like 5.
Well, it's not too bad. It's pretty much the same.
Yeah, maybe 4. Not
I'm
sure.
happy. I'm happy that we didn't went over, the level of pain. So the last thing that I want to show you is, come here please, get out of the plinth. Yeah, that's the right way to standing, to sitting on your bed. That was great. And remember what I told you about standing up? Great. 1, 2, 3. Up with your legs.
With a cane?
Yeah, with the cane that you are having there. 1, 2, 3. Good. I know you have to pick up your daughter. So what we are going to do to pick up your daughter is bend your knees. Right? This is gonna keep your back straight, but also it's not gonna put any loads on that nerve.
Okay.
Okay, so bend your knee like that.
With a cane?
Yeah, with the cane you can hold your cane here and yeah, just knee.
Yeah.
Does it feel good?
Yeah, feels
All right.
right.
Take your daughter. Now you don't.
Without the cane.
Yeah, you don't. You are not going to be able to use the cane, but leave your daughter. Make your daughter close to your body, and then you can lift. You're gonna lift her. Same thing for putting her in the ground. All right. So keep her really close to your body. Keep her really close to your body. Down, there, and then you can use your cane.
Right.
Okay. As much as you can, try to don't have her on your arms.
Yes.
Try to don't lift things from the floor. Try to keep yourself out of the pain. Not go over 5 or 6 out of 10.
Right.
Any questions for me?
No, that's all clear. When am I gonna see you again?
Never. Get out.